Good morning. I am now calling our meeting to order. I would like to welcome everybody who is joining us today virtually and hope everybody is doing well and healthy. We do not have any public comment that has been noted or brought to our attention. I'd like to begin by accepting declaration of conflict of interest. And Lori, would you like to call off the names of those who are there? I'm not hearing anything.
Relinda, you'd have to take yourself off mute. She's having trouble with that. Okay, Kevin, you're up.
Anything related to Texas Workforce Commission?
Hi, Rebecca.
Hi. Anything
Would you like to
group, please? Yes, anything related to child care group.
Thank you, ma'am. And who have I left out? I don't think Cherry, are you on the call? Connie, if we can identify Terry by his number and give him a panelist, he may have dialed in like Michelle. Any other abstentions?
This is Shannon. Shannon Gray for the Texas Department of Health and Human Services. Anything related to that?
Thank you, Shannon. Anyone else?
Excuse me, Lori. This is John. Relinda, it's if you tap on the screen, the little bar will come up and you'll be able to unmute.
Hey, John, this is Stacy. I unmuted Relinda.
Oh, fantastic.
Okay, there you go. Relinda, you should be able to speak now.
Oh, she's on mute again. There you
go. Can you hear me?
Yes, ma'am.
Okay. Sorry about that. I didn't know the key command for to unmute in this system. But yes, I have a conflict of interest related to TWC state matters.
Thank you, ma'am. Appreciate that. I'm glad we got you on here.
Thank you.
Any other abstentions or declarations? Anyone else? Madam Chair, we have the count.
All right, thank you. Well, first of all, I'd like to give attention and acclimate to our superstar, Lori, who has appeared on TV and was an outstanding interview that you had. Thank you for how well you always represent workforce. I thought it was very good, very good. So
I enjoyed doing it. I enjoyed doing it. Thank you so much.
You and Miss Jane were excellent. Since our last meeting, I keep thinking, wow, there cannot be not yet one more major event or happening in our nation. The last time it was our unemployment and our numbers and, making sure that you all were there for the individuals that need our services, and you have been without a doubt. Staff, just outstanding. And all of us were adjusting to this new way of working and actually living. And many of us have had impacts in our lives personally, as well as maybe at work. And then since the last time, we've had the killing of George Floyd, and that has created much unrest in our nation, and has brought on yet another layer of impact in a sad and negative way. And so I just encourage everyone to continue to remember who you are, continue to look inwardly as to how you can weather this time that we're in. The one would say good thing is that we have each other, and we know that what we stand for and the causes that we are, I would say the purpose for us and what we do is needed now more so than ever. And I am just thankful for all of you giving of your time, giving of yourselves for a cause that is much bigger than we are individually. And for Workforce Solutions Greater Dallas, I couldn't be more proud of this organization and the impact that you're making in many lives, even those that you probably don't even realize. So I say thank you and encourage us to continue to look forward and push ahead even during these times. So thank you. Lori, do we want to have our guests now, or do we want to go ahead and move into means, ends, and expectations? I can't hear anything.
That's because I put myself on mute. See, we all have to do it at least once a day. I was saying that's your call, and Ed is on the line now. We can let him get on with his morning after he visits with us. So that would be fine.
Oh, great. Well, I'd like to welcome Ed to come before us personally. We see him on TV. We hear his voice representing us in ways that he probably never even imagined he would be doing. And Ed, thank you. And thank you for having taken the time to be with us today and share with us, Ed Cerna. Thank you.
Good morning. Thank you, Madam Chairman and board members. Lori, good morning. I appreciate y'all giving me the time. I enjoy visiting in face-to-face visits, in-person visits over this, but I'm getting used to WebEx and Zoom and Teams and everything else that's out there. So thanks for giving me just a little bit of time. Lori did do a fantastic job. She always does, of course. This is nothing that I ever wanted to do. I've always been an operations kind of guy, not in front of cameras or reporters or everything else. So hopefully at the end of it all, it'll be something that'll be I'll learn from, but not have to do too often. There are a lot of things going on at TWC, a lot that y'all, of course, know about. I try to keep the board EDs informed directly or through our staff, but just to make sure that y'all know what's going on. We continue to serve individuals with unemployment issues, unemployment claims, though the number of calls has dropped substantially from its high. The high was over 2 million calls in a day to about, maybe 200 to 300,000 calls a day. But the good news is those are all coming from about 40 or 50,000 unique callers, which means that people, naturally being humans, get frustrated. They either get a busy signal or they get a message that says you've been put on hold. Be with you as soon as possible, and they hang up and call back. So that's a unique call. So we are seeing the number significantly decline. We have, in fact, paid out over $12 billion with a B billion dollars in unemployment benefits and pandemic unemployment assistance. That includes the extra $600, which many of y'all have heard in the news is a bit of a challenge nationwide with regard to getting individuals to get back to work. Just a little bit of a challenge. And we're paying claims out to over 3 million individuals now, and there's still probably about another 200,000 that we're working through to resolve issues. So we know we'll add to that number. At the same time as the governor has started opening up the economy, restaurants at 75% now, I think bars are at 50%, gyms and spas and amusement venues, Six Flags, things like that. We're also adding to our attention the workforce side, employment services. So in my simple mind, it's easy for me to say UI, or unemployment insurance, on one side, and employment services on the other side, which we all know is workforce solutions. That's where our board partners and you all are really playing a key role, and have been playing a key role. One thing that I've tried to emphasize, and all of us have tried to emphasize, is because we're not in our physical offices, and I normally am, by the way, except this morning my wife has a doctor's appointment, so I'm going to work from home this morning so I can take care of our boy Alex, who's sleeping right now because he stayed a little too late last night, and that's fine. But our board offices have been open and have been providing services. I think one of the first virtual job fairs that we had was in the Dallas area. Very well attended. Reports that I got were in excess of 1,700 individuals and businesses attending and participating. So we're going to continue to rely on board services to help bolster the economy, and we're going to work closely with the boards to do that. One of the commitments and one of the things that we've asked the boards to do is, as TWC turns work search back on for the unemployed, the recipients of unemployment insurance, that the board offices open up one physical location, at least one. They can open up all if they want, but at least one physical location where individuals that need access to computer resources in order to do their job searches, in order to find that next perfect job or career, as Commissioner Alvarez says, that they have a place to go. Now, one of the things that's at the forefront of my mind is the safety of our employees and our board employees and our customers, in that order. Our employees, board and TWC employees, are very important to me and to all of us, because that's how we get our services. That's who ultimately delivers our services. And of course, our customer safety is very important to us as well, their health and safety. So we'll need to take measures, maybe schedule appointments, limit the number of people we have in resource centers, ensure that we have proper cleaning protocols after someone uses a center, and social distancing, et cetera, et cetera. We'll need to make sure that masks are available for individuals that show up and don't have a mask. We also need to discuss how we will handle individuals that choose not to wear a mask. You know, if you go to Costco says you put on a mask or you don't come into our store. If you go to a Walmart or an H-E-B, they say we encourage you to wear a mask, but if you don't, we're not going to kick you out of the store. We need to decide what we're going to do and what we can do. I definitely don't want to put any of our employees in any kind of confrontational situation with any of our customers. So we're going to have to work together with the boards to determine how we address those situations and how we handle those situations, because again, the safety and health of our employees and our other customers is at the forefront of our attention. But we will be turning on work search. It's technically a decision that the executive director of the agency makes. But of course, I'm going to get the concurrence, which I did yesterday, of our commissioners. So at yesterday's commission meeting, we did present and got approval to reinstate work search. The schedule for reinstating work search is on July the 6th. That's when we'll turn it back on in the system. Individuals who are on unemployment at that point should begin their work search activities, and we're going to define work search activities very liberally, at least in the beginning. Excuse me. And what that'll mean is what they have to do is go online to Work in Texas and 3 times and attempt to find suitable employment. And then they would report that. They will self-attest that when they reach out to us and enter their continued claim. So every 2 weeks, in case y'all are not aware, every 2 weeks, individuals who are on unemployment insurance have to come back in and request a continued claim. for the next 2 weeks, can request their benefits for the next 2 weeks. When they do that, they'll answer questions about if they were able and available to work, and then report that they did complete their work search requirements. It's a self-attestation. We're not going to require them to send us any work logs. There's a little bit of a complicating factor there that I'll talk about later. It has to do with a subset of individuals that will be receiving benefits, but the vast majority won't be sending us work logs, won't have to go to physical interviews in the traditional sense or in any sense. Now, if they do that, that'll be great, and we do want to encourage that, because what we want to do is we want to get individuals back to work. That's the only way we're going to get the economy really going, is for individuals to get back engaged with their employers or with an employer. So we want to get those individuals back to work. Individuals that will be exempt from work search requirements are individuals that have a return to work date. They've been furloughed, but their employer has said, I'm going to bring everybody back at the beginning of July. Of course, that's a bad example. At the beginning of August, I'm bringing everybody back. We're opening back up. They don't have to complete work search requirements. If they're in training that's approved by TWC or a Workforce Solutions Board, and they're completing that training, then they don't have to complete work search requirements while they're in that training. Everybody else pretty much has to complete work search requirements. I think we got talking points out, and we're going to get more talking points out to the boards and for our staff to use concerning all this information. We'll make sure that y'all are aware of it. We're also we started our outreach yesterday. I committed to, and I say we, the staff and I, executive staff and I, committed to extensive outreach, and the commissioners reinforced that yesterday at the commission meeting, that they wanted communication on communication on communication, and that's exactly what we're going to do with regard to this issue and other issues as well. So, for example, if in Dallas there are 2 centers that are open with resource centers, all the centers are open, we'll want to broadcast that at the appropriate time. So, with regard to the outreach, we've already had a press release. We're also going to have things in social media. We're going to have direct communication with all 3 million plus benefit recipients, sending them emails or letters depending on their choice of communication with us. And we'll do that repeatedly, reminding them of the upcoming work search requirements. And then once we turn it 6, that work search requirements are on, and they'll need to report something. And then even on the first day, and the first time anybody has to submit any work search information is the week of July the 19th. So you can tell it's pretty far in advance. The week of July 19th. Even then, if someone fails to submit anything, we're going to ask them 2 or 3 times before they hit yes. If they enter 0, we're going to say, did you really mean that you didn't have any work search activity? And if they confirm it or say yes again, we're going to ask them one more time to confirm that they in fact have no work search activity. And we're going to say, if you're struggling or don't understand how to enter this, go to this link for information. It could be a video information. Go to this link, because we really want to make sure that people either enter their work search activity or if they intend not to because they've already found a job or something, then it's their decision. Because what happens if they don't enter work search activity after July 19th is, excuse me, their unemployment insurance benefits are terminated. The very next day, they get a notice saying there's no deposit today. You failed to meet the requirements to continue on unemployment insurance. And then, of course, we'll work with them if they still call us and say, well, I just didn't quite understand what you all were asking me, and here's what I've done. So a lot of communications in that area. We will continue to work with the board. One of the things that I don't know if Lori has shared with you all or not, but I know I've mentioned it to the board EDs on several occasions, is it's my intent to work with the board EDs to look at everything that we're doing in the system. There are 29 of us in this, not 28 boards in TWC, but there are 29 of us in the Workforce Solutions system. And it's my intent to work with the board EDs to see what we're doing, collectively that we don't need to be doing, and we can use those resources someplace else, what we're not doing that we need to do, what we TWC are doing that the board should do, and what the boards are doing that maybe we should do in order to save effort and resource and have statewide coverage, things that neither one of us should do and things that both of us should do again. So we're going to continue to look at that. And the way this links into what we're doing now is, in my mind, the pandemic and everything else that's gone on, as you pointed out, Madam Chairman, everything else that's gone on gives us an opportunity. The positive thing is it gives us an opportunity to look at all of our operations and improve what we're doing, change for the better we're doing. So where in the past we may be focused on on real job fairs, now we can have real and virtual job fairs. Where we had training conducted and provided one way, we may be able to expand our training opportunities, all because of the requirements of the COVID emergency. And also where we served our customers and the way we traditionally served our customers, we may be able to change that, because I know that the boards have been successfully serving both employers and job seekers through this emergency, not being in their physical location, and we may be able to broaden our services. TWC as well, we have 91% of our employees are teleworking. I normally go into the office every day because I have an almost 8-year-old and we distract each other. Otherwise, I'd probably be working from home as well. But I think it's a good opportunity for us to see how we can expand things. And the first start for us is how we begin to serve our customers as we, TWC, turn on the work search requirement again, where we get employers and our job seekers reconnected. If you've been out to work in Texas, you'll see that there are over 500,000 jobs posted, but there are over 2 million resumes posted. So we already know we have more job seekers than we have jobs. So we're going to have to, again, the system collectively, the 29 of us are going to have to work diligently with our employers to try to increase the number of available opportunities, work with our job seekers to provide them enhanced training that maybe they can be available for other types of work. And then we're going to have to finally look for ways to work. And we do now, by the way. This is not to say that we don't or that the boards don't, but look for ways to provide services across the state where maybe there's a need for CDL drivers in Central Texas because of the Amazon and the Walmart and the H-E-B warehouses or other warehouses, distribution points, I should say. And there are CDL drivers in the oil fields of West Texas and South Texas, and maybe connect those employers with those job seekers across board boundaries more seamlessly. So that's kind of how things are moving. With regard to TWC, we have been open for business also. Our staff has been providing as much support and doing as many things as they can outside of the office. Like a lot of state agencies, we still rely a whole lot on paper, unfortunately. So we do have individuals coming into the office to scan documents so we can get them into systems and get them out to our employees that are working remotely, or to receive mail, receive packages. A lot of cases receive affidavits from individuals that are appealing UI decisions or other decisions. So we do have some staff coming into the office, but the majority, vast majority, are working from home, like the boards. I will say, like the rest of the state, we are seeing an increase in the number of cases of COVID-19 or COVID-19 exposure at TWC. And we're going through our own internal contact tracing and cleaning. But this week alone, we've seen more employees directly or indirectly diagnosed with COVID-19 than we have in the past month and a half, 2 months. So like the rest of society, we're seeing that as well. And I think we've got some good steps in place that we'll share with the boards, and we've gotten some good ideas from the boards that we're using as well. So we continue to make ourselves available. I appreciate you all giving me the time, so much time out of your board meeting. I know it's a very, you've got a pretty packed agenda. Lori shared that with me, but I appreciate you all giving me the time to meet with you. I'll do it anytime that you all need anything. Please feel free to reach out. or if you have individual questions, feel free to reach out to me, and I'll be glad to visit with you about anything that you want to know about what's going on with TWC and how the system as a whole is getting along. So with that, I'll be available for any questions that y'all might have.
All right, Ed, thank you so much. We're very fortunate to have you as our Texas Workforce Commission Executive Director. I know this has been quite an undertaking, but we are very appreciative of all of the direction that we've received, everything that you are doing. And I agree, the silver lining in this is that it has given us an opportunity to really examine our ability to be ready, our readiness, looking at opportunities to ensure sustainability moving forward, just not knowing what the future holds. So thank you for that. If anyone has any questions, please unmute and ask Ed your question. So we'll give you a few seconds to unmute.
Susan is anxious and followed by Mark York.
Okay. Hey, thank you. Thank you, Ed. Thanks so much for taking time this morning with us. This is Susan Hoff. And, you mentioned having a child at home, an 8-year-old, which many of our colleagues are having that opportunity and challenge as well. I wonder if you might comment a little bit on the outlook for childcare, since that's such a significant part of not only the budget but also the work of TWC.
Absolutely, absolutely. One of the things I think we've done well in an area where we can continue to improve is our support of our child care providers and our families that we support. Reagan Miller has done an outstanding job, and she makes sure that she keeps me and the commissioners informed, and she's participating on the governor's task force. The big challenge that we faced initially was how to provide funding, and I think we got some pretty creative ways how to provide funding to child care providers when the number of children that they were serving was being significantly reduced. And we even figured out a way to provide them funding when they weren't serving any children. Now the challenge that we have is, as the governor opened up the economy and child care providers are allowed to take children other than those of essential workers, families, how we continue to support them there, given the fact that a lot of what we did, and we're still in the middle of the emergency, so I shouldn't say during the emergency, but earlier in the emergency, was we waived a lot of requirements. We suspended a lot of our rules. The absenteeism or the attendance requirements, the work search requirements, those kinds of things. Now we're needing to reinstate those because we need to slowly begin moving, and that was some of the commission action yesterday. We need to slowly start moving into back into what is, quote, normal. The challenge we still face, to their credit, is some of our child care providers don't want to fully expand. They can't. And again, to their credit, they don't believe that being at full capacity the way they were prior to March the 8th or the beginning of March is really a safe thing to do, but they can't financially be viable in this new model. And we've heard from them. We're trying to figure out how we can address that without basically tanking the system. It is the largest funds, the largest amount of funds that we have at TWC, in excess of $700 million. But when you're spending it statewide, it goes pretty fast. So we're trying to figure out how we can still support them and make sure that money lasts us as long as it needs to last us. We did get some emergency funding from the federal government. We've used that. There's a little bit of that funding left. I shouldn't say a little bit. It's more than I'll ever have in my bank account. But when you look at it statewide, it's only a little bit. We have several organizations that are appealing to us and to the governor's office to provide funding outside of our to providers outside of our network of providers. We need to, of course, make sure we address our network of providers, and we are going to do that. And then also there's what I'm going to call the normal business of what we were already planning to do, which was to create a new level of Texas Rising Star, sort of an entry level, to expand the requirements, to be able to expand the population of providers. We still want to be able to do those things and have the financial resources to do that. But I mentioned UI and ES, and the third component of that is childcare. Of course, the other is our own internal operations in my world. But childcare is at the forefront of what we're doing. And every time we have a commission meeting, we provide updates to our commissioners. I get at least bi-weekly updates from the team and from Reagan on our activity. And we know we have a challenge still because, again, to our providers' credit, and Alex went to a daycare that's just up the street here, one we really like, and they've been closed. They didn't reopen. They haven't yet, but that's because they wanted to ensure the safety of their children. Others have reopened and have been able to do so safely, but they can't expand those populations. So we need to work with the providers, with the advocates, and with the task force to figure out what we can do and how we can do what we can do to continue to keep them available to us, because we don't want the population of providers to be reduced when we come out the other end of this emergency. It would cost us more to try to rebuild that network than to keep it going. So,
Ed, this is Lori. I know that we're working, committees are working on contracts for childcare, and that is going to be a necessity, I think, in the Dallas market if we ever get back up on a full scale. We're losing too many providers, and kudos to our local governments. The county has given us $400,000. The city of Irving is giving us $500,000. We're also now waiting on the city of Dallas to give us maybe $750,000. And when I say us, it's into the system, micro grants to stand up these child care centers long enough for them to be available when we need them. And that is crushing right now. But I thank you for all of that. I'm going to go on to Mark, Susan, if that's okay. Mark?
Yes.
Question.
Thank you so much. Ed, thank you for speaking with us today. My name is Mark York. I represent organized labor here in Dallas. I'd like to start off by first saying that we are 110% against everything what you just said. This policy is going to jeopardize the lives of workers in this entire state. The virus is spiraling out of control. It is going up, not down. And you're jeopardizing workers' lives by forcing them out there to do this. This also comes from the entire state of Texas. I speak on behalf of all of organized labor. I do respect y'all's opinion, but your system couldn't handle it to begin with, let alone now having everybody be calling in with these jobs and dealing with this. So I just want to go on the record, organized labor and the working families of Texas would like you to reverse this change. Thank you.
Mr. York, I appreciate that very much. One of the things that I didn't mention is, of course, we are very concerned about the health and safety of of the state's workforce, the entire workforce, not just our workforce at TWC or the boards. And I know I would assume you recognize that, since those employees, our employees, are also employees that you would represent, not as labor necessarily in unions, but representing all the workers of the state, as you've indicated that you do. One of the things that I didn't mention is that part of the action that the commission took yesterday was to approve a position that the staff has taken, that I and the staff has taken, which is at a minimum turning down suitable employment. Normally, conditions of health are not reasons for turning down suitable employment, but these are not normal times. So we've ensured that we have clear instructions to our staff that the commission validated for us yesterday, which is if someone is at high risk because of age or health condition, or is in a household with somebody who is at high risk because of age or health conditions, so it's not an and, it's an or, then they can turn down a suitable job offer and not risk their benefits. Second, if they themselves or someone in their household has been diagnosed with COVID-19. Well, of course, we don't want the individual in the workplace, and I'm sure y'all wouldn't either. We don't want the individual in the workplace. But if someone in their family, in their household has been diagnosed with COVID-19, then that's another valid reason for turning down suitable work. Also, if they're quarantined, and I have a couple of employees that are quarantined right now, they have not been diagnosed with nor tested, but they've come in contact with somebody that has, or actually in one case, two cases, someone who has come in contact with somebody else. If you're quarantined, then you can turn down a suitable job offer. And then finally, if there are childcare issues, you can turn down a suitable job offer. But if the employer, the position that we take, and we know that we're going to stand at odds with you on this, and we'll continue to work with you, however, on how to resolve this, because I know you, like us, prefer that individuals not be on unemployment insurance, but rather be working. If the employer is providing a safe work environment, then there are no reasons for the individual not to return to work. If the employer is not providing a safe work environment, and that's validated, then there should be no reason that individual not receive unemployment insurance until they find suitable employment that is safe for them. So we're going to continue to look at each of these on a case-by-case basis. You're absolutely right, and I'll be the first to say, when the flood of individuals, because businesses were shut down, not because businesses shut down, but because they were shut down, when the flood of individuals hit a system that was not designed for that kind of volume, we did struggle with that. We believe we've gotten past those struggles. On this side, on the employment side, we are much more prepared. And again, with regard to what they have to submit, what individuals have to submit to us with regard to their work search, we're not asking them to go out and knock on doors and drop off resumes. That will be virtual. Our instructions will be pretty much, you go to work in Texas 3 times a week, and you look for employment. And then you self-attest to us that you did that 6 times in a 2-week period. You completed your work search requirements. That's all it is. So we're not putting any workers at risk from that regard. And then finally, those individuals that already have a return to work date don't have to go through this if they're in training, and we're going to have a lot of training available to help upskill individuals. If you're in an authorized training from us, you don't have to complete the work search either. So we agree 100% that we don't want to put at risk the workforce in the state of Texas, but at the same time, and I think that you all might agree, and if not, we understand, we do need to get the economy started again. We have paid out in excess of $12 billion in unemployment insurance benefits. That's both state and federal. Our trust fund is bust. There is no money left in the unemployment insurance trust fund. We have already borrowed 4 times, which we already knew we were going to need to. But we borrowed 4 times from Title 12, which is a federal program that allows states to borrow funds for their trust fund for these kinds of emergencies. We pre-requested that money back in March and early April. We thought we were going to need to in May, and we didn't, because Texas employers came across with $985 million in tax payments. But here at the beginning of June, about 4 days ago, was the first time we had a drawdown from the trust fund, and we'll be drawing down from the trust fund every day. And we need to get that rebuilt so that it's available to our workers when they need it in the future. Should something else, not like this, but some other situation come up that affect an individual, hopefully not like this. But I understand the position. I've had conversations with several representatives of labor here, and of course our commissioner representing labor. Conversations. We understand where y'all are at and the concerns that you have. We don't completely agree, but we don't disagree either. because we are concerned about the safety of our workers. But I do appreciate your comments, and I understand the position.
Thank you.
that
Yeah, we
you've
just think
taken.
a little premature, and there's no enforceable safety standards being held by any employees. Like you said, it's pretty subjective whether they're providing PPE and what are the rules. Yes, and if there was rules in places, enforceable rules, that'd be a whole different story. But we will not get that from this governor, and we think you're premature on starting this up. But thank you for listening to our concerns.
Yes, sir, absolutely.
I want to thank you both. That was a very refreshing dialogue to disagree and still have an informative dialogue. I thank you both very much. Ed, could you talk in light of Mark's comments? I think we're at that juncture where the federal pandemic benefit, which was $600 a week, which has been probably saving lives, saving families, but that will go away unless Congress does something July 26th. Now, what have you heard about what will happen? Let me explain to the board. There's a two-edged sword. The $600 provides $15 an hour. That's kind of the touchstone, is if you got nothing but the federal $600, 40 hours a week, you're making the new minimum wage mentally. But most people get a state benefit. If you're a low-wage worker, it might be $179 plus the $600. But if you have been a long-term worker at a high salary, you're going to get maybe even $400 or $500 plus the $600. It prevents people from going back to work because it is such a secure place for some workers, particularly our younger service workers. And we're thankful they have that cushion. But will there be a $600 after last of July? Will there be a reduced sum? What are we looking at in the future?
Sure. Yes, ma'am. So here's what I understand. I've had conversations with my colleagues in other states, and collectively through our representatives at NASWA, we've had conversations with House and Senate committee staffers and committee members. In addition, I've had calls with congressional staffers. There is an interest, and there's an understandable need, just as you described, for some benefit above the base benefit. Unemployment insurance, as everybody understands, the traditional unemployment insurance was intended to tide someone over between jobs. And in Texas, that's only about 45% of the weekly wage. Your weekly benefit is only about 45% of your weekly wage. The $600 was a godsend, I believe, to a lot of individuals. We were one of the first states, I'm very, very pleased with our staff, we were one of the first states to make that available to our labor force. I think we had it from the time the CARES Act was passed until we were issuing that check was within 2 weeks. And it might have even been within a week, but within 2 weeks. And it was also that same period of time that we were able to bring on board the self-employed and the 1099 employees. But the things that I've heard are, one, of course, an extension and continuation of the 600 to December. The other thing that I've heard is an extension of something, not the fixed 600 every week, but something that is tied back to your unemployment insurance benefits. So maybe it is a percent on top of your unemployment insurance benefits so that it rises and falls, but you still have it available to you if you go back to work part-time. And then the other thing that I've heard is something that is just a reduced amount, but it's still a fixed amount. It's not scaled to your unemployment insurance benefit, but it's simply a reduced amount. So instead of $600, it's $300, and then that would be extended for at least another 3 to 6 months. So I've heard those three things. The fourth thing that I've heard is that the 600 would end and it would be replaced with, so I've heard two things in this case. 600 would end and it would be replaced with a return to work bonus, or that the 600 would, or some portion of the 600 would end, but there would also be some bonus for return to work. So if you lost the 600 because you went back to work, you would receive some kind of a federal bonus, maybe 2 weekly periods of $600 that would be available. Of course, there's also the other noise in the background. I shouldn't say noise because it's serious, but the other noise in the background about another round of stimulus. But the thing that was the most beneficial, I think, to our individuals, both our self-employed, our employed, and our 1099 and our nonprofit employees, was the $600. The majority of what I've heard is something to extend that kind of a benefit at least through the end of the year, and that they would have that be paid out through our system because we've already got the mechanisms in place.
I appreciate that information. I think we're all anxious to find out where we go from here. Ellen, I'm going to ask one more round, guys. We've got a couple more minutes. This has gone a little longer than I thought, but we can get the agenda finished by 9 o'clock. We're still taking another question or two. Anybody? Okay. Nobody's got a question for your own company or? Okay. Ellen, I don't see any other questions.
Okay. Well, Ed, again, we cannot thank you enough for, excuse me, taking time out of your busy schedule to come and speak to us, update us, and answer our questions. And as you said, we're all in this together. And Workforce Solutions Greater Dallas is here, ready to assist in any way possible that you may have identified or will identify in the future. So thank you on behalf of all of us for today.
Thank you. Thank you very much, Madam Chairman. I appreciate you giving me the opportunity. Also, Ms. Hoff and Mr. York, thank you for the questions. And if any of you all have any, not just Ms. Hoff and Mr. York, but if any of you all have any questions or feel that you want to reach out to me, please feel free to do so. Lori's got all my contact information that she can share with you. And I'll be glad to discuss any issue that concerns Texas workforce system or the commission with you at any time. So thank you very much. And I'm gonna leave the meeting and let you all get to your meeting.
Thank you, Ed.
Thank you.
Thank you, Lori.
All right. So we're now ready for meetings, ends, and expectations. And I don't know who's up first here.
Richard?
That is me. Good morning, everyone. My name is Richard Perez, and I'm Research Manager for the board. And I'm going to start on page 3, and that is the labor market snapshot for the Dallas Workforce Board. I got to give credit to Mario on our staff. He created the report, but I'm going to go through it. So the first thing, the labor force stats, unemployment rate for Dallas County is 12.9%. That is an increase up from 4.8% in March. The claims, they are for Dallas County, the most recent information we have, almost 194,000 or just a little bit over 194,000 claims. And those are initial unemployment claims. And he also created a map that shows what the claims are for the other counties around us. For the state, just over 2.5 million claims for Texas for the most recent information. Something that's important on this page is the job postings for the last 30 days. I thought that's important. You know, what are the jobs now in this economy? We only pulled the top 5, but the increase is the percentage. So truck drivers or CDL drivers, those increased 11%, as well as all the other ones. And then we have some of the current layoffs that are happening in our area. The next page is it's a report that the Texas Workforce Commission has prepared in Tableau, and it sort of takes a deep dive into the unemployment insurance claims. They broke it up by weeks, going all the way back to the start of COVID. which is March 15th, and through the most current that we had for the packet. So this is the report for the week of May 31st, and there were 9,139 claims for that period. And this is some of the demographic information on that. And I just wanted to point a few things. The one is the race of the claimants. At first, Hispanic was the lead in the number of claims being filed, but most recently with this report, it's African American, and they lead in those claims. The age range of the claimants is still trending young, excuse me, and that's pretty much been consistent through the whole pandemic. And as far as education, the same. It's been consistent. Most of the claimants have a high school diploma with some college. So I just wanted to point that out. And I'm going to go ahead and go to the next page, which is a Jobs Now summary. And the number of claimants outreached. The most recent figure we have, which as of this morning, is 6,815. And I just wanted to thank everyone that's worked on the Jobs Now project, board staff, ResCare staff, and all the employers that helped put this together to get people back to work. There's still work to be done, but the project is coming to a close now that we have a date or some plans in mind to reopen some centers. Like I said, there's still work to be done, but the work will start being done just in normal daily activities in the center. But this, gotta thank again all the staff, ResCare and board and employers that worked on this. The next thing I wanted to talk about was the NPR.
Let's break there before we get into the NPR. I also want to thank everyone that was on Jobs Now and the Chamber for their partnership. Emmett Smith has done a great job getting the word out that there are essential jobs that needed to be taken. These essential jobs will still exist, but they are diminished. We are not seeing the volume of activity. Things have sort of settled into a new normal. Anybody have a question for Richard about the UI data, the Jobs Now data, anything thus far? Because what he's going to go into next are the standards, the performance metrics that we have to meet for grants. Any questions about what we've just covered? Okay, if I don't disconnect myself here. Richard, proceed.
All right. So back to the NPR, and what that is, that's like a report card for us. The state gives us one every month, and this is for the month of April. So I just wanted to point out a few of the measures, particularly the ones we're not meeting. But before I go into that, I wanted to touch on the claimant reemployment within 10 weeks and the employer receiving workforce assistance. Those haven't been reported all year, and I just wanted to say there is no information on that. The choices performance, that one is, we're not necessarily clear where the state is going with this measure. And this performance measure is the participation rate of TANF recipients in work activities. And when COVID cases started to rise in March, many of the choices participants, their work activities, they came to an end, along with some of the other activities. And that's one of the reasons that the measure isn't doing that well. And in the next few pages, and I'll touch on that, it doesn't just affect Dallas. There are 20 other workforce boards not meeting this. And that's a big increase. Last month, there were 13, and the previous month, it was even less than that. So we just wanted to point that out. The other measure we're not doing well in is the adult Q4 employment rate. And what that is, that's like a retention rate. When somebody gets a job and is reported, they check to see if they are still in that job in the fourth quarter. And we are just barely under the target of 90%, and we're coming in at 89.7. So we're almost there. I believe we will be meeting when we add an additional quarter of data, and we'll look through and see if maybe someone had some supplemental wages or another reason why it wasn't meeting. But we do have an eye on that one. And let's see. And on page 8, that is the performance comparison, just a one-pager of all of the 28 workforce boards and how they did on each one of those measures.
If I can just interrupt again, it seems that we have a disconnect with the state. And I didn't want to put Ed on the spot. There are measures that are not available to be met. And that would be fine if we're just talking about us, the board, and keeping the grants going, and that will be worked out. But the problem is each board has a contractual relationship with someone who runs the workforce centers. In our case, it's ResCare. ResCare's performance matrix leads to their incentive, for lack of a better term, profit, their incentive for having run the program. So this change, without recognizing the change and making a decision early, is causing us a good deal of stress on whether or not we will have leftover money in that category that was previously intended for incentive, and whether or not we will recognize the really hard work that ResCare has done despite the inability to meet this measure. So choices is welfare families. Irony of ironies, the state determined that we can actually pay their wages while they were interrupted in their work experience. So a good example is CVS had probably 20 of our subsidized employees, training, learning. They sent them all home. And the state determined that we should continue to pay them their rate while they are not working, which is a wonderful thing to do, but will not let us count the credit for that activity commensurate with the investment. So there's a lot of disconnect going on. The 10-week measure, as Richard said, it says in A on here, the state has not relieved that from our grants. So we're working through some interesting times of trying to realign expectation to grant. And I know the state is fighting with the feds on the same basis. And there are so many multiple grants in here. So I'm going to come back to you in August, hopefully with better information about which metrics we're being held to and which metrics we can use to recognize the work of our ResCare contractor, our child care contractor. People have done unbelievable flips, pivots, and restarts to make sure that our system did continue. But the matrix for the incentive is different than what was intended. So we're going to take another stab at that and come back to it, and keep working with the state to see if they will relieve us. They can't relieve us on follow-up data, the fourth quarter measure that Richard mentioned, but on the real-time measures was, first of all, people are going to be 22 weeks on unemployment if they go through the July period from the middle of March. Is that a good thing or a bad thing? What was the best effort? So do we turn the clock back on? Do we omit all the performance that occurred or didn't occur in those 4 months? These things have not been worked out, and we want you to be aware of that. And we will be working to rectify this. This is crazy.
Hey, Lori, this is Ken Malcolmson. As you said, there's an obvious disconnect under choices here. And but what is Central Texas and Golden Crescent and Panhandle doing differently? Because they're clearly outliers.
Yes, Ken, and they are small to mid-sized boards where they could probably invite their denominator to lunch and accomplish social distancing. It just depends. I don't want to make light, but in fact, when you're dealing with the large populations that a Houston and a Dallas and a San Antonio and an Austin have to deal with, you're much more likely to lose ground. So those are hanging on. Richard, I don't know the metrics on those. We don't really have those handy, but it fair to say, I know the Central Texas director. They're doing a great job, but they have a small problem to work with. And not every area of Texas closed businesses. So where CVS may have sent everybody home in Dallas, they may not have sent everybody home in Killeen. And that's the kind of thing we're dealing with. This is a localized issue when you talk about COVID, particularly in Texas. Austin is pushing. Mayor Adler came out last night. He's pushing very hard, more to Mark's point of it isn't safe yet. I want to require face masks. The governor doesn't want to require face masks. We're butting heads right now on what is the proper protocol for communities and who's in charge of communities. Right now, it's the governor. We almost didn't have this meeting today because the governor's executive order, thank you, John Dickey, was not extended until 11 a.m. Thursday for a declaration that expired on Friday of last week that allowed us to continue having virtual meetings and still meet the Texas Open Meetings Act. But we had that much notice that we had a heads up. John called the state. They weren't even aware. And there's little nuances. So the unemployment is a good example. The $600 is a national figure. Well, that's almost an overpayment in Texas. That's putting some people in a situation where they don't want to return to work because they will make less. But it's not necessarily the case in New York or California. That 600 isn't paying the rent. So we are the alignment of the whole system, the alignment of the conversation, the alignment of the remedies is lacking. And that's what keeps me up nights. And to be frank, we'll talk about the reopen plan. We have had our first positive case among staff in the field, and we're not even open yet. So when Ed was talking about that, it is real and it is here. And we will fight this every day as we reopen centers. It's an appointment only initially, but we're going to try to be seeing customers in the centers with every precaution possible. The state has not, they're still considering, I think, but they issued a policy that said we could not use the grant money to buy face masks for our customers. We have private money. I intend to buy face masks, and I can't require them, but I can sure as heck offer them, because I think anybody in Dallas going on a job interview, especially an in-person interview, needs to have a face mask, because you don't know what culture they're applying in and what the HR professional will think if they see them show up without a face mask. I don't know. It's hard to tell. Everybody's got a different view of the elephant on this one. But that's just an aside, Richard. I thought I'd kind of give it context about the lack of alignment. I have a few mics open. Anybody have a comment?
I do, Lori. Oh, I'm sorry. Go ahead.
Yeah, so before we pivot from the labor market data, Lori, I just wanted to ask Richard, with the unemployment rate at 13% and so many that are dislocated and disconnected from the labor market, do you have a sense of what the growing sectors would be? Because at one time it's retail and construction, and so as we try to connect them, what are you hearing from employers?
Construction is, from what I've seen, is still consistent. A lot of the construction activity is still going on. They might have had a little bit of loss of employment. For the most part, things have been consistent. In addition to that, warehousing, distribution centers and things like that, that's actually growing. And those are the two that come to mind that are doing really well.
Richard, if I can talk a little bit.
Sure.
We would say healthcare, Michelle, but healthcare at a certain level, because we've seen displacement in healthcare. And I think the problem is it's not what you need in the company, it's what you can afford. And I think we're seeing a whole lot of variables that were not anticipated when you have a layoff at a Baylor. It's a cost savings measure, particularly when there are these benefits on the table. Ken and I sat on a lot of small chamber conversations with the city where we're talking about so many small businesses going under. But you got to remember these behemoths, these large businesses have also taken advantage of the $600 and have put people on leave, on furlough. And Richard's people have been calling the employers, I would say, Richard, between 40 and 50% a given that they think they are returning to their jobs. So that is the one variable Ed didn't talk about. There's a large number going back to work. We hope. You got Mark. Mark?
Yeah, hey, I just want to piggyback on what you were saying, Laura, and share with the rest of the folks on this call. Our phones are blowing up from workers that have no one protecting them. And this is real world stuff out there. We're dealing with families that are dying, people that are catching it at work, but you can't prove you caught it at work. But they're being forced and starved back into their jobs with no enforceable measures whatsoever. And that's what's really going on, that the employers don't scare our customers so you can't wear a mask. So back to what Laura is saying, I'm going to piggyback on that. And then what's going on with forcing people back into this workforce is ridiculous. When we actually have to, and maybe some of you are actually looking and talking to the fathers and the mothers that are dying. I don't know, has anybody here had to look and talk to someone's father or mother that's died?
So Mark, when you're saying being forced back into the workplaces, you're not seeing any accountability for organizations not to do that? I'm not.
Yeah, there's some employers out there that are telling the people, you will bring in your own personal protection equipment, or providing them nothing. And if you don't come tomorrow, you don't have a job. Or if you get sick, stay home and you're not getting paid. I mean, it's all over the board. We have really good employers, Southwest. We go, yeah, it isn't the big ones. And some of the big ones are bad. You know, they didn't get on the front end at the beginning when their employers wanted masks. It wasn't only until after the fact, you know, a lot of them got sick, but at least they got on board. Unfortunately, they should have got on the front end, but there's no enforceable standards out there for workers.
Just about everything is geared as a best practice, and that is true. We are, yeah. Now, the state is saying that if you will not return to work and your employer reports you, the employer has an obligation to report it to the state. There's a place on their website. Employee refused to return to work. They will negotiate with the employee to find out. Thank goodness it's not just a, one-time deal. They will negotiate to understand, do you have someone in the home? Have you been exposed? Do you under an underlying health condition? You're 65 or you have a 90-year-old parent in the home. There is some opportunity, but again, that's heavy work. This is really heavy work for the state to engage in.
They don't have the facilities to handle stuff comes in. And as a union rep, you know how many times I've heard workers say, I'm going to sue the company? Well, I hate to tell you, you're not going to outsue Southwest. You're not going to outsue Pepsi. The pockets are so deep. Yeah, the provisions are there, but the reality is it's not going to happen.
And strangely, the bigger companies are doing the right things. And that is the other side. So we aren't seeing where people have the real issues.
Right. And it all sounds good what he had to say.
I know, Mark. We hear you.
Okay,
I think Ed heard you. I thought that was good. Who else?
As long as you guys hear me and your companies out there.
Somebody else on the line? Okay, Richard, return it to you.
Okay, well, that concluded my report, unless there are any additional questions. But yeah,
I believe Ashley is next. Ash?
Hello, I'm Ashley Berner, Chief Financial Officer for the board. Expenditures and financial statements begin on page 9 of your board packet this month. And I'd like to take this time to mention the possibility of an inability to spend funds due to COVID-19. We continue to pay our fixed costs, such as leases and payroll. However, our grants are available for specific programs, and as such, we do have a potential for underspending this year. I'd like to walk you through just a few examples. First, I'll make mention of our child care local match grant. Many local sources for our match are not currently operating. TWC requested a federal waiver for these match certifications due to COVID-19, but was not granted such waiver. As such, if we do not receive certifications to allow us to draw the matching amount from this grant, we would be required to return that money to the state. Another grant that may result in lapsed funds this year is the Child Care Quality Grant. This is another issue that is not unique to the Dallas Board. The state recognizes that boards are having difficulty spending quality funds this year and has provided guidance on ways to spend the funds in areas such as health and safety, enhancement of Texas Rising Star, and professional development, among other areas. Our temporary assistance for needy families or choices grant is also at risk for lapsing funds if we are not provided more clarification on performance in the coming months, as Richard discussed during his report. Turning from our expenditure discussion to our overall financial statements, I just want to let you all know that Crow LLP, our external auditors, did wrap up their fieldwork at the end of May on schedule for our annual audit. We have scheduled our Finance Committee meeting for July 29th. If there are any questions relating to financial matters, I would be happy to discuss at this time.
We anticipate the committee meeting to be virtual. Terry is on the line. He's on a phone. So if any of you, we'll make sure everybody gets the notice. If others of you would like to participate in that session, we'll have some information on insurance policies, on the outcome of the audit, any of those things. So if we're still in virtual world and you'd like to be in the room, it's a lot easier. Any questions for Ashley?
Ashley, this is Ken Malcolmson. Was the entire audit conducted virtually, or was a portion of it in person pre-pandemic?
No, the entire audit was conducted virtually. They began their fieldwork right at the beginning of May. It's about a 3-week fieldwork process. Rowena Ho, our accounting manager, and I took turns going up to the office to pull paper samples and scan into the auditors. But other than that, we were all at home and we did video and phone calls with the auditors and submitted everything electronically. And they've always been on an electronic system, so that wasn't very new to them. It was just we were doing the scanning for them.
But I assume in the past that they would be on site at some portion of the audit time.
Correct.
So, okay, but that worked out well.
It was usually a 2 to 3 week period with some assist. And this year we had some virtual meetings, we had some telephone calls, the interviews were conducted, but it was different and it felt different.
And Lori, will that invitation for the Finance Committee, will that go out to all the board or just to the Finance Committee?
That's what I'll do it to the whole board. Ashley will get that out to everybody because I think it's a good time for information and you get to see a little more of what's going on behind the scenes.
Great, thank you.
Thank you.
Madam Chair, I think we did add, we can just go into the president's briefing and try to wrap this up.
Okay, that sounds good. Thank you.
The COVID reopening plan, we did send you the plan. I won't belabor it. 2 concerns. One, when there is a positive case, we will do extreme cleaning. That cleaning is costly. I don't know if any of you have been through that. We've heard from other boards, it can be as much as $3 a square foot. So we will embark on that and procurement for that and making sure that we can do CDC standard in any center that has a situation, and I do anticipate this will happen. No matter how careful people have been, ResCare has been amazing. They have their PPE in order. They have ordered plastic shields for the reception desk. We are trying to do everything by the book, pointers to assist someone with working on a computer. As Ed said, the main focus of the governor and of the state is that we provide access to computers and good transmission for people who are excluded from that service. It's great to have a virtual job fair today. We're having the DeSoto Works job fair today. It kicked off just minutes ago. But if you don't have a computer, if you don't have a phone, and if you don't have reliable Wi-Fi, a virtual job fair is of no use to you. Senator West has made this point. The libraries are not necessarily open in all communities, and so it's up to us to make appointments with customers who are genuinely in need to come into one or two of our centers in the coming months. We'll start that on July 6th, as he mentioned. I do have a problem with the face mask not being required and temperatures not being required. We will do face mask and temperatures for all staff who go into the centers, and there will be minimal number of staff initially, 3 and 4 staff. We're not going to rush this. Some boards are already up and running. There's not a problem perhaps in Pecos. So again, the alignment of conversation has been difficult for us because they're not writing the rules for Dallas and Houston and Austin. Mayor Adler has been stronger than most. I expect Mayor Turner to speak up. And of course, we know our county judge. Clay has been on the front line from day one and has probably helped the conversation in Texas more than people give him credit. External grants. That's Connie, actually. Connie, would you touch on those two real quickly?
Absolutely. Can everyone hear me? Just make sure. All right. Okay. We recently received a WIOA grant for COVID-19 activities. We received $585,536. Part of those funds will pay for the time for rapid response activities. These activities assist dislocated workers to go back to work. Layoff aversion activities, that's short-term training activities to dislocated workers so they can quickly get off unemployment insurance. And then the third pot of money is to provide hardware and software for teleworking as well as protective equipment. We're applying for a Dallas Ready for Life. This is sort of new for us. It's a Department of Health and Human Services grant through the Administration for Children and Families. We're focusing on young adults and we're working with ResCare, and this is a focus to offer quality or assistance for quality relationships and parenting practices to become more stable and productive adults. We're coupling that with our regular workforce programs, and the end goal is to help people get back to work, but to be stable, protective adults. The estimated budget is $500,000 to $700,000, and we're focusing on 170 youth. So that's pretty much what I have for external grants, Lori, if anyone has any questions.
Are there any questions or comments? Because I think there's a motion for this one.
Well, I think we'll do them all at the end, Ellen. One motion. Okay. We can do that. The HHS grant I was going to explain is under the Fatherhood Initiative for those of you who are familiar with that conversation. So it is trying to build better parents, better families, better relationships, which tend to build a more stabilized environment for people who enter the workforce if they can get their home life in order.
Yep.
So those are great things. Thank you, Connie. Dee, childcare is a little messier, as we know.
Good morning. I'm Demetria Robinson, Vice President at Workforce Solutions Greater Dallas. We have a few updates on childcare, not as much as we had in the past few months. Last month, we presented 2 external childcare assistance funding opportunities that we received. It was $20,000 from North Texas Cares. These are private dollars. to provide microgrants in the amount of $3,000 to approximately 7 Dallas child care centers that have remained open. And the other was $400,000 from Dallas County Emergency Child Care Assistance Program. And these funds are from the CARES Act funding to provide microgrants in the amount of $3,000 as well to approximately 134 Dallas County child care providers, but not in the city of Dallas that also have remained open. Since then, we received additional funding from North Texas CARES in the amount of $16,667 that allows us to provide additional 6 microgrants in the amount of $3,000 to Dallas child care providers. As Lori mentioned earlier, we've been in discussions with the city of Irving to offer similar opportunities in Irving. We've been asked to administer 2 different projects for them, $500,000 to provide microgrants in the amount of $5,000 to approximately 100 child care providers registered in the city of Irving. And then additional $750,000 to provide subsidized child care payments directly to child care providers to assist parents who are returning up to 90 days. Now, this is a new opportunity. We're still finalizing those plans and hope to get that finalized this week. These are great opportunities for our child care providers and new funding sources outside of our normal subsidized child care program. We have an update on parent share of cost. We've discussed lowering the parent share of cost over the past few months, but changes continue to occur. There are multiple variables in play, and due to COVID-19, we have determined to continue our analysis and we'll bring back recommendations at a later time. It's just too many moving parts right now with childcare to make that decision. And also, Ed mentioned that the commissioners took action to reinstate the requirements for the parents of children receiving child care services to record their child's daily attendance. This will be in effect July 20th for our parents to start swiping once again. So we got to get some correspondence out to our parents to remind them that that card needs to be utilized when they're taking their children back to care starting July 20th. And I think that's all that I have, Lori.
Thank you, ma'am.
So Dee or Lori, you know, early on we had the situation with the essential workers, and then we were bringing back others. So are we able to, I'm not sure what the priority list looks like, or is it just first come, first serve? Where are we with that?
The priorities, Ellen, did not change. We tried to ask the state for permission to move essential workers to the top of the list since there's no longer a fund, and that is refused. They will just be considered to be workers at this point. So the priority begins with the welfare customer, the teen parent, the most in need. We return to those metrics. Dee, what else is atop the list? And that list is still in place. For those parents that have not been bringing their children to centers, we've kept those centers paid. That changed in May or June. Everything's moving back to a set of normal rules that in non-normal times. So it's an alignment issue again. Dee?
And we will not be able to enroll any new parents at this time. We're kind of on a freeze again.
Okay. And so with the rise in cases, until we get new direction from the governor or the judge, we're going to stay on the path that we're currently on, which is like back to normal.
We don't really have an option, Ellen, and that's kind of Mark's frustration. The governor is overriding all local jurisdictions at this time, and we are atypical in Dallas. So is Austin. Houston is quietly atypical.
Okay.
It's rough.
Thank you.
It's rough. We have one more item, but I think Ellen's point, maybe we take up everything in the action up to the authorization to proceed with our logo for Dallas Thrives. And Carrie O'Connor is with me, and Carrie will join me in a minute for an on-screen. But before I lose any more members while we have quorum, let me read the action in, and if someone will make the motion, or once you make the motion in a second, we can have the question and answer period. We're asking for board authorization to contract WIOA grants for the pandemic response. Connie mentioned those to ResCare as appropriate. ResCare handles our training funds. We will buy the equipment, and there's about 30 to 40 people at home who are working on inferior systems. We want to get them up to speed. Authorization to contract Dallas Ready for Life. If we get the grant is on a very fast turnaround in July, again, to ResCare for their youth program and consortium partners as we identify them. I don't see Alan on the call, but we are looking at CPAL and the Family Place as consistent partners in this project since we are going for whole family. Authorization to contract pass-through dollars for child care assistance to Child Care Group. All the grants Dee discussed, we're not in the business of disseminating money directly to these child care providers, but that's what child care does beautifully. And so they will use their system. There are checkpoints in this. We have to get a signed statement from the child care provider that they lost 25% of their business. We are having the county and the cities check to make sure they're current on their taxes. They did not receive PPE and then PPP, sorry. And then they will receive a check from one of those funds, hopefully, if they are still in business. And our goal is to keep them in business another 90 days. As stated in the draft. Also, to accept money from other municipalities, I am expecting the action of the city of Dallas today to perhaps lead to additional money for city childcare providers, hopefully around $750,000. But as we all know about city council, anything could happen. So I'm not, and the city could decide to do it themselves. We don't care who manages it. We just care that we keep these childcare centers alive long enough to return to normal. So that's our goal. It's not where they put the money. Just please invest the money in childcare providers because they have been left out. Having said all that, if I can get a, Ellen, if you can take a motion.
If I can get a motion.
You have Mark York's hand up. Mark makes the motion.
Can I get a second?
And Shannon made a second.
All right, all those in favor?
Any discussion? Any discussion?
Any questions?
Anybody? Nope. Getting head nods. Nope.
Nothing there?
Good.
All right, if we see that all those in favor, unmute aye.
Aye. Aye.
Aye.
All right, any abstentions? I think we may have on this one. Child care. Any noted?
Terry, I think Terry's on the phone, but I will put him in here. Terry for ResCare and Rebecca for Child Care Group. I don't believe any action here concerns state employees. I think you guys are all clear.
Okay, so moved. Thank you.
Thank you all so much. Please don't leave. This is a very important reveal. Carrie O'Connor is with me. Connie, are we going to share the screen real quick? For the Thrive. I know we sent out the presentation, so we don't really have to if we don't want to.
Stacy indicated that Carrie could share her screen.
Hi, Miss Carrie. Welcome. There she is.
Hi. Sorry about that. I'm happy to try to share my screen if I can. Actually, it's not showing I can, so I'd recommend maybe we just go ahead. I know it's the end of the meeting and everyone's been very attentive so far. First, good morning. My name is Carrie O'Connor, and you may have seen me recently coming in front of the Workforce Board because I'm a former business executive who's very passionate about workforce development and have worked with Lori and her team for many years in this space as a volunteer. I'm here this morning to talk to you about a new emerging community coalition that is forming, one that Lori and her team are at the forefront of driving, as well as many of our business leaders who are on the Workforce Board. The context for this is is many things. In particular, we all talked about this morning how the pandemic is dramatically changing the workplace. It's changing jobs, and there's an increasing need for workforce development as all these changes are occurring to the nature of jobs and work and skills that are needed. But at the same time, we're all facing extreme budget challenges. So that's one reason why I'm here this morning to talk to you about a community coalition that's working to build bridges in Dallas with the shared goal of helping more of our young adults who are 25 to 34 move into living wage jobs and helping our local employers find qualified employees in our community instead of hiring outside. Now, what this is a community coalition. It's voluntary. But the concept is to organize around 5 key driving initiatives where we can build bridges between the institutions, whether they're educational, whether they're government, and the organizations and employers, where we can address them together by combining resources and combining our mutual efforts, tracking and measuring success with clear ownership and regular meetings. Much of this is documenting informal relationships that already exist. I know everyone here has been in the Dallas community and has been a leader in the workforce space for some time. And you know there's many, many relationships behind the scenes that get things done in our community. But when somebody moves into a different role or a relationship changes, then sometimes those relationships and that effort will dry up. And that's why a systems alignment and a governance process helps to make that more long-lasting and more effective. So what is this that we're talking about? The effort is called, and before I go any further, would like to acknowledge and thank PepsiCo, Frito-Lay, and the United Way of Metropolitan Dallas for their support of this effort. Both organizations, have been leaning into this work for some time in our community and have been leading the way. They founded and launched an initiative called Southern Dallas Thrives back in 2018 that has many overlapping objectives to the Dallas Thrives effort. Southern Dallas Thrives aims to increase the quality of preschool education in Southern Dallas communities, provide nutritious meals, and helps high school students with career and college preparation. So we see that there's a lot of overlapping focus. So let me talk to you a little bit about Dallas Thrives now. Dallas Thrives was kicked off in March of this year at a retreat with over 60 community leaders, including Lori was there, as well as many board members were there, the mayor, etc. We kicked it off to make sure that we thought this is the right time to build these bridges, that we thought this is the right time for organizations to lean in this space. And we got a resounding yes, that people were willing and interested in leaning in. From that time period, we then kicked off a formal study with Boston Consulting Group. The drivers behind the study were a smaller subsection of the community leaders, a steering committee, as well as support from the Commit Partnership and the Dallas Regional Chamber. And the group met for several weeks, had several steering committees. We also conducted 30 stakeholder interviews across the community, surveyed about 3,000 Dallas County high school students, 5,000 Dallas County community college students, and many, many employers. So pulling all this information together, what we've come up with is the draft that you see in front of you today. The North Star that we are coming up with, that we are going to focus all our effort on, is on living wage attainment and doubling living wage attainment in a single generation with equity in our community. And the reason why we came up with this North Star is for reasons that you as a member of the Workforce Board are very familiar with. We know that only 1 in 4 of our young adults in Dallas County earn a living wage, it's amazing. We know that credentials and degrees are the key stepping stones to living wage work, that 80% of living wage jobs in Dallas County require education beyond high school, 80%. Yet we see that, of course, many of our young adults are not obtaining that training or that credential that's necessary to be qualified for those positions. Now, how are we going to organize the work? You can see this is a very big lift and a very big goal. We're organizing the work around what we are calling the 5 big moves. And the 5 big moves are: first, workforce pipeline alignment. And this is a space where the Workforce Board will be leaning in quite a bit. For some time, we've had a lack of clarity in some spaces about what are the highest priority jobs in our region and in our city, particularly those jobs that pay a living wage. This is very important now. Again, I'm speaking to people who are experts on this, but as jobs are rapidly changing, many of our training institutions, whether education, whether they're collegiate, whether it's the Workforce Board, need help and clarity on making sure that we are aligning all of our training towards where the real high priority jobs are. So we're going to be creating a partnership. Again, Workforce Solutions is going to be helping to drive this. We're going to be creating a centralized thought and report on what we should be focusing on for this effort. Now, that's not taking away from the Workforce Board's responsibilities in this area. They produce, as you all know, regularly produce reports and information on this topic, and we anticipate that that will be a significant driver of this work. The next component is focusing on career exploration and guidance. For those of you who are familiar with career exploration, either in the secondary or post-secondary world, it's fairly limited these days. Our schools do try and have some good emerging programs, but a lot of students aren't exposed to careers, aren't getting full information about what jobs are out there. A lot of our teachers, and particularly our counselors, aren't aware of it either. And then students education, which is something we see with the Dallas County Promise when we're talking to students. They don't quite connect college or further training with what careers they want. Or they go on to college, and unfortunately they end up spending quite a bit of time and money without obtaining a degree. I've always loved the phrase that college is a very expensive career exploration tool. It's not something we want to encourage in this time where student debt is so high. So we're going to be creating the systems and programs to better guide students, their parents, and their influencers, because we know influencers are incredibly important to our young adults, particularly our low-income students, on what their career options are. Again, trying to help focus information on high-demand living wage careers. The third component is college and career readiness and acceleration. This component is making sure that students are ready to either enter into college, post-secondary, a career, or the military. It is also going to be focused on how do we reconnect with those young adults who are already out of high school, who didn't go to college, and who are working in our community at living wage, or at minimum wage jobs. That is finding a way to reconnect with them and to bring them back in and help them understand how further education will help them move on to careers. For example, we're in talks with the community college. We're also in talks with UNT and other organizations about how do we change our recruiting efforts to particularly focus on these populations, to find them, to help them understand what the schools can offer, and to develop the wraparound services that they may need in order to come back to school. Number 4 is connections to the workforce. We all know that work experience is unbelievably important. Lori talks about that extensively. It is so important. Whenever you look at jobs that a high school graduate can get, they have to have work experience. So this particular focus is going to be bringing together the many different initiatives that we have focused on work-based learning, like internships and apprenticeships, and to make it more of a cohesive system with clear training and guidelines for employers, as well as the students or young adults who are participating. We recognize that with COVID, that is a big challenge right now. We very much recognize that. That said, it's not something that we can ignore until COVID is solved, because we don't know of course, none of us know the future. So that's something that we're going to be building up that system. There are already quite a few efforts in the community focused in this area. Some incredible internship programs. Of course, the mayor's internship program. Dallas County Community College has done quite a bit of work on coming up with an apprenticeship model. So there's already quite a bit of work that we're pulling together. There's also many employers who are interested in trying to figure this out with the understanding that COVID is a challenge. Last but not least, and this is probably the most important part, I personally come from a manufacturing background and have spent many years as a business leader trying to plug into the workforce community and trying to plug in and help in the education community. And I know how hard it can be. For those of you who are interested, whether it's through a philanthropic interest, a personal interest, or if it's an interest in developing employees for your company and your talent hiring pipeline, this big move, number 5, is bringing together the organizations that represent employers that are engaging with employers. So, for example, as you can imagine, that's the Chamber, United Way, the Citizens Council, the TREC. There's many out there. It's bringing them together to create a streamlined process for employer engagement in education and in these big moves, making it easy, consistent, and scalable. It is also creating incentives for employers, a way to celebrate employers who engage in the development of and benefit from local talent. Now, that was a lot of information. I recognize it's the end of a long meeting. I would love to discuss this further with anyone who is interested in learning more, share more information, etc. We're moving forward very quickly. We anticipate that the report will be publicized within the next couple of weeks, and we are actively forming committees and getting things organized to kick off, with the Workforce Pipeline Alignment Committee already starting to. So these are moving quickly to provide information. The purpose today was, 1, just to make sure that we have a chance to brief the Workforce Board on what the effort is, invite you to join it. And 3, most importantly, we would like, and this is Lori's ask, we would like permission to be able to use Workforce Solutions logo on the report as a partner and supporter. It will be joining many other great logos. We are very fortunate. The version you see in the draft report is a draft. We are in the process of getting approval, but I will say we have approval now from, I think, 34 organizations, including many large corporations, as well as school districts, colleges, etc. So please feel free to reach out to me with any questions. And then please also let us know if we can use the logo as support in the report.
Carrie, thank you so much.
Do we have any questions?
Ellen, I just want to add that Richard and I have both been actively involved. It's been difficult, in fact, to get everybody on the same page, but we're working for common data use. The community college, the chamber, Richard, Mario has been involved. And I've been from the retreat on March 5th to every one of the 3 online meetings that we've had, the web calls. It is a robust initiative. The North Star is critical. Changing within a generation, finally getting to the conversation of living wage in Dallas and bringing more services to people who live in Dallas and hopefully convincing them to work in Dallas. So that in mind, I am on board. We are reserving any policy conversations for the future. So anything like that, if you would, we're just saying, let's use the logo and stay the course for the partnership.
Okay, we do have one comment here that has come through. If we can set up a call to discuss. I think it's Stephanie.
This is Carrie. I recognize, again, it's the end of a long meeting and this is a big, heavy topic. What I will do is put in my email address. You're going to see it's a Dallas County Promise email address because I have worked with the Workforce Board and the Chamber for 20 years through the Regional Workforce Leadership Council. The component that I'm adding to bring to this coalition together is the Commit Partnership. So I'm currently associated with them. I will send out a Dallas County Promise email address and my cell phone number. I can also send out my personal email address. I will speak with anybody who's interested because it's through the coalition that we're effective.
Thank you. Lori, this is listed here as needing board authorization to continue the involvement and inclusion of our logo.
Yes, ma'am.
If I can get a motion.
Stephanie?
All right, Kelly. Thank you. A second.
Second.
Michelle?
Okay. Any abstentions? Let's see any. All those in favor, unmute and aye.
Aye.
Aye. All right, no abstentions. All right, so moved. Thank you. Thank you very much. All right.
That concludes the business of the day. I just want to tell you guys, we're doing the best we can do. Please stay safe. This thing is more insidious than we think. A lot of people suffering and don't even know it. And there are a lot of asymptomatic. I hope you're taking great care when you do go out. And I'm encouraging our team at all levels. This is not over, and it is not time to forget what we know.
That is so true. Thank you, Lori. Thank you to staff, all of you who are working so hard on this and will continue to. I want to thank all the board members and all of those publicly who have joined us for the meeting. I think, Lori, this is it for the summer, right? We're back in August.
Yes, ma'am.
All right. Well, everybody, please have a safe and as best you can, enjoyable summer. Thank you.
Yeah.
Meeting adjourned.
Take care.